Many approaches have been proposed to open the blood-brain barrier, and intra-arterial drugs, laser. All of these approaches have disadvantages, either toxicity, either diffuse and not focalized opening of the blood-brain barrier. The main advantage of focused ultrasound opening of the blood-brain barrier is that as I said, it's a focused opening, so we can target a volume, a tumor or a cavity, surgical cavity, and it has been shown that this is possible with few or no side effects. Many preclinical studies on animals, on rats, mice, non-human primates, and in my knowledge there's only one study that is being occurred in humans, actually in Paris. Many preclinical studies that have shown that the technique is possible, the technique is safe, probably safe, but now we have to go to the human clinics. There are two main techniques. You can deliver ultrasound through the bone, because the main challenge with ultrasound in neuro-oncology is the problem of the skull, because we know that ultrasound do not cross the skull. The bone interface induces distortion, absorptions of the ultrasound. So that some and many teams have worked on delivering ultrasound through the bone with very complex materials. And in my team we designed, Professor Alexandre Carpentier, who is a neurosurgeon in La Pitié-Salpêtrière Hospital in Paris, designed an implantable device that can be implanted into the skull, so that we do not mine with the skull, and we directly deliver the ultrasound on the brain parenchyma. And it's a classical ultrasound device. Ultrasound are delivered in conjunction with microbubbles, intravenous injection of microbubbles, and microbubbles in the ultrasound beam are going to vibrate, and this physical mechanism induces stimulation of the endothelial cells that constitute the blood-brain barrier, and the first consequence is the opening of tight junctions that are very tight junctions between endothelial cells that are the particularity of the blood-brain barrier that impede any drug to cross the blood-brain barrier. So opening of the tight junctions, it has been shown that it induces transcytosis, opening of cells with channels into the cells, and well, with high intensity ultrasound, it can damage, of course, the blood-brain barrier, and opening a large opening into the blood-brain barrier. But it's almost opening of the tight junctions and transcytosis. This device has been designed to be useful for neurosurgeons. So it's a small device that is about 1 centimeter diameter and some 1.5 centimeter deep, that can be implanted in a classic burr hole that we do as neurosurgeons when we operate skulls. And this device is totally MRI compatible, so that we can survey, we can check patients with MRI without any interaction. This device can be implanted very simply during any surgical procedure, including with local anesthesia. It's implantable into the skull in small burr, and then is totally under the skin, and the connection is a transcutaneous connection that can be done with a simple connection through the skin without any pain, and when we want. So that the objective is to synchronize the opening of the blood-brain barrier with ultrasound to the chemotherapy protocol, so that we can open the blood-brain barrier when we want during some hours, and then diffuse the chemotherapy by intravenous injection. Because in this kind of technique, blood-brain barrier disruption is transient. It's some hours, and then the disruption disappears and the blood-brain barrier closes. We have 17 people that have been tested up to date, but the results are not official. The study is being done, so that I cannot say more about this. Now, this technique, this approach would be used in children also, and we would like in my department to use this technique in children in the next months. The implantation of the device can be done in adults, in children, without any difference, and as we can do the opening of the blood-brain barrier either on general anesthesia or under local anesthesia, it can be done in children without any difficulty. The safety is being assessed actually with the phase 1 trial that is being occurred in Paris. But what we know is that from the preclinical studies that have been done in mice, in non-human primates, in dogs, in rats, is that with this approach, the opening of the blood-brain barrier only induces some microvascular opening and microvascular hemorrhages, extravasation of some erythrocytes, blood cells, into the brain parenchyma. And some papers have shown that repeated disruption of the blood-brain barrier do not induce more side effects than single sessions. Some have assessed EEG modifications, metabolism modifications, behavioral modifications, and we, up to date, we have not seen any side effect about all of this with this technique. So it seems to be safe, but next protocols will confirm it. First, to finish the protocol that is being assessed in Paris, actually, with adults, and we would like to first complete preclinical studies with new drugs, with drugs that are efficient on in vitro on high-grade gliomas or DIPG for children, for example. And the next step is to open a new protocol, a phase 1 trial in children to check the toxicity of this technique and check the feasibility of the technique in children, to envisage secondarily phase 3-4 trial to try to evaluate the effect of the technique on gliomas or DIPG or other brain tumors. Well, the technique seems to be very encouraging because it seems to have few side effects, and with the technique we will be able, if it works, to deliver drugs focally with targeting fashion and when we want, by synchronizing the technique with the standard chemotherapy protocols. So that I think that we have to encourage clinical trials with this technique because it seems to be a nice technique.